All right, New South Wales health authorities have banned Victorians from attending all major events in the state and are strongly discouraging anyone from virus hotspots in Victoria from travelling after 33 cases of coronavirus were detected across the state in the past 24 hours. I spoke to New South Wales Health Minister Brad Hazzard just a short time ago.
It's a very difficult issue at the moment because obviously Victoria is having some challenges with the transmission of COVID cases. Today they've had 33 cases, of which around about 20 or so are transmitted. The others are from people flying in, returning Australians, returning residents. But we're particularly concerned about the fact that Victoria is having some challenges. So we don't want here in New South Wales, we definitely do not want any likelihood of people to come from Victoria, particularly in the Melbourne hotspots, the 10 hotspots that the Premier of Victoria has announced today. We don't want them coming to New South Wales, to either our regional areas or to our cities, no part of New South Wales. We can't run the risk of having more seeding, more transmission being initiated by Victorians who may have this virus, this very dangerous virus. So we're asking Victorians to stay at home. They're starting their school holidays, and we're saying, we know you might be coming up to New South Wales in other circumstances. Now's not the time. Do not come. We've also asked the AFL and the NRL to look at ensuring that tickets. I mean, this is difficult because we don't want to be stopping supporters for Victorian teams from coming to New South Wales, but right now we can't run the risk. So the AFL and the NRL have both said that they will ensure that tickets are not sold to Victorians at all in the next few weeks till we see how we go.
Are you also urging New South Wales residents not to travel to Victoria?
Absolutely. Unless you really need to go to particularly Melbourne, you shouldn't go. New South Wales residents are putting themselves at risk, and they're putting obviously their families, their friends and other New South Wales residents at risk if they then return to New South Wales, which of course most would. So the message is very clear. Please be on this journey with us. The community in New South Wales, indeed really all communities across Australia, have been on the journey with their own state and territory governments and the federal government to try and beat this COVID virus. Right now we need New South Wales residents to be every bit as good as they have been in the last 5.5 months and listen to the message from public health officials and the public health team here in New South Wales. Dr Kerry Chant, with whom I work every day, is basically saying, please do not go to Melbourne or to the hotspots. Up until this afternoon today, we weren't sure exactly what suburbs in Melbourne were the hotspots, but Dan Andrews and Jenny Mikakos, who I talk to very regularly, the Health Minister in Victoria, have identified those 10 hotspots today. You can go online and see them. Definitely don't go to those hotspots, but really, preferably, don't go to Melbourne. In fact, if I think I can put it this strongly, avoid Victoria for the time being. We just need to know that we're keeping people here in New South Wales as safe as possible.
Now, Minister, we've had another case of a student testing positive today in New South Wales. Are you genuinely concerned at the prospect of New South Wales, which has the highest number of deaths in the country from COVID-19, sort of, a trigger like this in Victoria, a second wave, if you like, could occur in your state?
We had a 7-year-old student at Lane Cove West Public School test positive, and we're now doing, public health team is now doing all of the tracing. So that means we're now having our very professional staff who've been trained up to make the necessary phone calls and contacts with anybody who may have been in contact with that student. They're doing all that to try and find out who may else have had that contact, because that actually goes to the issue of trying to break the chain of transmission of the disease. If we know who's been in contact, we can ask them to go into isolation for 14 days and just make sure that this disease doesn't get another head up. Am I concerned about how we might go here in New South Wales? Of course, absolutely I'm concerned. and so are all the public health officials, so is the Premier Berejiklian. We are extremely concerned. What really worries us in New South Wales is people have forgotten that we went from 0 in January to more than 200 cases by the end of March. That wasn't, that was 8 weeks. We went from nothing. We had 4 cases right at the end of January and then 212 at the end of March. This disease can move so quickly, and it kills. It's a killer. So we need everybody in New South Wales to understand that as we try and give back some normality, as we get back at the things that we want to do, we're all desperate to get out of the house and to go to a cafe or a restaurant, have a coffee, have some dinner, see our friends, do the things we wanted to do. And as we've taken that chance here, it's a trust thing. It's very much a trust thing with our community. And so we have to be so careful that our community return the trust to all of the rest of the community and make sure that they're still washing their hands like there's no tomorrow. Washing your hands once or twice in a day? No. Washing your hands many times in a day or using the appropriate hygiene cleaner, the hand cleaner, is critical. Making sure that you maintain the 1.5 metres social distancing. This virus is not a high jumper, not a long jumper. We've talked about that before, but you get too close and you may well get it. And if you get it, we only need one person who can see the whole community. So we need people to take this seriously. We're asking our fellow New South Wales people, residents, to take it seriously. Keep in mind, the World Health Organisation has today announced that it's still progressing at a great rate across the world, and the work that we have done could all disappear in a flash if we don't take this seriously.